Good evening, everyone. I'm Jonathan Capehart in for Joy Reid. We begin the readout tonight with new urgency in the fight against COVID, with the U.S. crossing the 35 million COVID-19 case milestone late Sunday. Today, the White House said 70% of all U.S. adults have had at least one vaccine dose, almost a month after President Biden's original goal of reaching that mark by July 4th. One of those vaccines went to Senator Lindsey Graham, who announced today that he tested positive for COVID. The senator added he is, quote, very glad he was vaccinated, saying his symptoms would otherwise be far worse. It's a message the public health community is desperate to get out, that the vaccine is highly effective, despite the fact that breakthrough infections can happen. They are, for one, very rare. According to data collected by NBC News, breakthrough infections in 38 states represent, and listen to this number, less than 0.08% of the 164 million plus people who've been fully vaccinated. And the number of cases, the number of cases and deaths among the vaccinated is very small compared to the number among the unvaccinated, with the former Biden advisor on COVID-19 estimating that 98 to 99% of deaths are among the unvaccinated. The Delta variant, however, is much more transmissible and extremely dangerous, especially for the unvaccinated, which is why we are seeing those mask mandates pop up again. The San Francisco Bay Area has reinstated an indoor mask mandate, and Louisiana, a state that is running out of ICU beds as COVID cases surge, will be back under a statewide mask mandate starting Wednesday. The nation's leading infectious disease expert, Dr. Anthony Fauci, doesn't think we'll see a repeat of 2020, but he did share that things look grim in the months ahead.
I don't think we're going to see lockdowns. I think we have enough of the percentage of people in the country, not enough to crush the outbreak, but I believe enough to not allow us to get into the situation we were in last winter. But things are going to get worse. We're looking to some pain and suffering in the future because we're seeing the cases go up.
Joining me now is Dr. Kavita Patel, a physician and a former Obama White House health policy director, and Dr. Peter Hotez, infectious disease specialist and co-director of the Center for Vaccine Development at Texas Children's Hospital. Thank you both very much for being here. Dr. Patel, I'll start with you. And just to get your thoughts on the mask mandates that are popping back up. We just talked about San Francisco, the state of Louisiana, the CDC recommending people wear masks indoors. Your thoughts on that?
Yeah, Jonathan, good to be with you tonight. I fully support these, and not even mandates. I would just say, to me, I would say universally, I know the CDC has really recommended indoor masking for places with substantial or high transmission. Jonathan, it's very hard to know how to look up where you are and where your caseload is in your county. And it's just simpler to say, while we are all kind of going through this surge, and if you're in a place like Florida, Jonathan, it's the worst it's ever been than the first two waves, not as bad as the winter wave yet. So I'm fully supportive of it. What I'm scared of are the states like Florida, like Texas, that have gone out of their way to not allow for even schools to put in mask requirements.
And Dr. Hotez, your thoughts on mask mandates, but also what Dr. Patel is talking about, what's happening in states like Florida, where the governor is going out of his way to prevent local officials from doing what they see as in the best interests of the people who live in their cities and towns.
Yeah, that's absolutely right, Jonathan. This is the scary part now. We are seeing a very worrisome surge across the southern states, and it's going in a giant shape of a U, starting in Missouri down to Arkansas and Louisiana, cutting across east into Florida, then going up into the Carolinas. And it has a different flavor from the surge that we saw last summer. It's true that we have a lot more older Americans who are vaccinated, so the deaths are nothing like what we saw before. But what we're seeing in its place is lots and lots of young people getting sick and lots of hospitalizations for young people. And we're even starting to see now pediatric intensive care unit admissions. I don't think this virus is selectively targeting kids. I just think pretty much anyone who's not vaccinated is getting swept up in this. And the big worry is in August here in the South, schools start early. They start earlier than they do up in the North. And I think this is really going to act as an accelerant for this epidemic. And what I'm holding my breath about, given the fact that except for Louisiana, we don't have mask mandates. We certainly don't have vaccination mandates for COVID-19 vaccines. We have a very low number of adolescents vaccinated, the lowest in the country. Fewer than 20% of adolescents are vaccinated in most southern states. This is a powder keg, and so I'm worried we're going to start seeing lots of pediatric hospitalizations and pediatric ICU admissions, and so that really worries me.
And yet we are seeing there's a 70% increase in vaccination. I think this comes from Jeffrey Zients, the White House COVID-19 response coordinator, who said that there's been a 70% increase in the last week, the average number of people getting vaccinated against COVID-19 after weeks of pleading with people to get vaccinated because the level of vaccination had sort of leveled out. Now we're seeing this spike in people getting vaccinated. Dr. Patel, is that because of people taking seriously all the reports of the surge because of the Delta variant?
Well, yes, I think, Jonathan, almost everyone I've talked to who's kind of come into my clinic recently to get vaccinated, they've all said, look, I know someone who was young and healthy and got COVID and is sick. They've all been kind of touched personally by it. To Dr. Hotez's point, there's just very little places for the virus to go except the unvaccinated, and it's going to be very smart and efficient at replicating in the unvaccinated. We're also seeing some of these breakthrough infections, which are catching people's attention. It's not undermining vaccine confidence, but even Senator Graham's experience, it could have been far worse if he were not vaccinated. And so I do think we have an opportunity. Unfortunately, getting vaccinated today does not help with the straight upward slope that we're seeing of increases in cases. It'll save your life, but it's not going to prevent what is this kind of roller coaster of an epidemic and pandemic we're seeing throughout most of the state.
And Dr. Hotez, there's a report out that Germany, from Reuters today, Germany will in September just start to offer a booster shot against COVID-19. Do you think that that is something that is going to a decision that will be made here in the United States, that the folks who have been vaccinated will need to get a booster shot?
I think there's a high likelihood. It may not be a universal recommendation. It may start out with certain groups. We're already seeing some data, although there's small studies on those on immunosuppressive therapy, bring up their levels of virus-neutralizing antibody if they get a third immunization. Israel is now giving third immunizations to those over the age of 60. So I could imagine a scenario where we move forward with that. And later on, as other variants circulate, because we're doing a terrible job of vaccinating Africa, Latin America, and Southeast Asia, that could build in more resilience also through a third immunization. So I think we'll eventually get there. It may come in stages.
I know I mentioned before sort of triumphantly, we're seeing an incredible spike in the number of people getting vaccinated. But then the dark side of this comes from a story in the New York Times on Sunday where a survey of data from 10 states shows that about 1 million doses have gone to waste since the nation began administering COVID-19 vaccines in December. Much of the loss comes as demand for inoculations plummeted. Dr. Patel, should we be worried that as people start to take getting vaccinated seriously and go out to get the vaccine, that we could end up seeing shortages because of the number of vaccines that have to be thrown out because they do have expiration dates?
Yeah, Jonathan, nothing kills me more. I've had to throw away some of those doses, and it literally breaks my heart every time that happens because, as Dr. Hotez knows, this could save a life everywhere here and in any other country. I'm not worried whether or not it's just that we're gluttonous, or you could argue that we were really, really prepared with Operation Warp Speed to have these contracts and manufacturing arrangements in line. I'm actually not worried about running out of vaccine. What I am worried about is that the American public is probably going to have to deal with COVID for a while. And when I say a while, I don't mean days or weeks or months. It might be several years, and it's because we need to vaccinate the whole world. And I don't know how we can all adjust our lives to that. And we're going to have to do it, but we have to do it by getting vaccinated